The state will get 89,000 doses of vaccine each week, and they'll be distributed at places like Fenway Park and other locations nearby. But there is uncertainty if the federal government will meet our state's demands. Vaccine distribution chaos. States begging for more. Feds telling different states different amounts. And some states even remixing CDC guidance for who should get vaccinated first.
States have the option to follow that guidance. And, I was visiting Florida not too long ago, and they were opening up vaccines to those 65 and older, but their systems were overwhelmed. Now, their hospitals, their vaccination sites were overwhelmed.
In New York City, Mayor de Blasio says they'll be running out Thursday.
Nothing left to give as of Friday. What does that mean? It means if we don't get more vaccine quickly, a new supply of vaccine, we will have to cancel appointments.
The squeaky wheel gets the oil, right? So mayors are complaining to their local state public health departments and to their governors. Governors are challenging the federal government to make sure that they get the information they need and they get the doses they need. And that is the way our system works, is that you have to be in line, making noise.
Here in Massachusetts, we'll have several people making noise for us.
We have a considerable number of our local health experts that are now going on to work within the Biden administration. That gives us a direct access, including the head of the new CDC is from our hospital system here. So we're excited that creates some channels for information, but also some access to get what we need.
With those extra channels giving us hope, the state continues opening new vaccination sites. As we get all of these sites popping up, should there be any concern that we're not going to get the influx of vaccines that we need?
Even though we're competing against the rest of the world, if we run into challenges, here's where I'm most looking forward to. It'll be communicated to us. Like, we'll understand, because I think part of what we've been a little frustrated about across the country is shooting in the dark.
So back out here live, the state is excited about more transparent communication, but members of the advisory board say the biggest challenge will not be phase one, but in a month or so when we transition over to phase two. They want to make sure that we have learned all of our lessons from phase one and make sure that this is a seamless transition, Vanessa, making sure that there's no systems crashing, making sure there's no lost doses. They want to make sure it is seamless when we transition to opening up the vaccine to the broader community.
Yeah, makes sense. And Wale, I have family and friends in different states who are not first responders, but they've already received the vaccine. I was telling you earlier that my dad got the vaccine, his first dose tonight in Georgia. I heard that advisory board members say the reason is that some states have broken away from those CDC guidelines. Will we ever do that here in Mass? Are we going to ever break away from those CDC guidelines?
It's possible, depending on the need. Curry says one of the reasons those other states have done it is because of the rapid rise in cases that we've seen over the last couple months. So there's a chance that we do it, but we want to stay in phase one and stay with the CDC guidelines for two main reasons. Number one, we want to make sure we're taking care of our healthcare workers and all those people on the front lines. And number two, Curry says, if this becomes a free-for-all where everybody can just get their vaccine, there will be communities, especially communities of color, that will be behind in that distribution.
Wale Aliyu answering some questions that we all had tonight.